All right, so in this video, we're going to talk about deductibles, coinsurance, and out-of-pocket caps or maximums. So let's talk about deductibles. The basic idea behind a deductible for health insurance is the amount that you're going to have to pay before the health insurance gets involved in paying. And the motivation behind this is basically to ensure that the people who are receiving health care sort of have the proverbial skin in the game, where you have an incentive to be thinking about how much health care you're getting and what you're spending and what the cost is and so forth. So this is essentially the money you're going to pay before health insurance gets involved. So that's the idea behind a deductible. Now, there are kind of a couple of ways that deductibles can be applied as it relates to particularly within the context of a family plan. So if your entire family is on your health insurance, or some portion of your family is on your health insurance, then the distinction between embedded deductibles and non-embedded deductibles matters. So let's talk about what those mean. So for embedded deductibles, then you actually have essentially an individual deductible and a family level deductible. So let's suppose that you have an individual deductible of $1,000 and you have a family deductible of $4,000. What that means is that for the individual, you have to pay $1,000, the first $1,000 of basically healthcare costs. That's the idea behind the individual deductible. And once you go past the $1,000 of healthcare costs as an individual, then if you, as with that particular individual, incur another $500 of healthcare costs, then you will have met the deductible and you'll probably be moving into the coinsurance phase of your health plan, which we'll talk about that in a minute. Now, if your family deductible is $4,000, what that would mean is if you have, say, 4 people in your family total, let's say you have 5 people in your family total, and each of you incurs $1,000 of health expenses this year. Maybe you were in some kind of a car accident or something like that. So the individual level deductible, if it's $1,000 per person, then each person is sitting right there. Let's say everybody had $1,000, you had $5,000 total with 5 people in your family. So the individual level deductible is just met for everybody. But what's significant is the family level deductible, if that's $4,000, even though at the individual level you would have just barely maxed out, the family level is $4,000 total. And so what will happen in that case is before I hit person number 5 and their $1,000 of spending, we've basically maxed out. Okay. So when you have embedded deductibles, you have an individual limit, but also a family level limit. Okay. So if the individual limit, basically you're looking at per person, they pay that certain amount up to the maximum, but there's sort of in effect, sort of a family level limit on that, sort of a cap, so that even if I haven't met the individual level limits across everybody in the family, I could have possibly maxed out the overall family level deductible, at which point I would move into the next phase of the insurance. The other possibility is that you have a plan that has non-embedded deductibles. So if you have non-embedded deductibles, that basically means you just have no individual level deductible. Everything's just at like the family level. And so in that case, if you have a $4,000 non-embedded deductible as a family, that means no matter whose health expenses they are, your family is paying the first $4,000 of the health costs. Whereas with the embedded deductible, you actually hit a cap per person. So if one person has a whole lot of really expensive stuff that goes on, you could actually hit that cap and move into the next phase of the insurance much sooner than you would for a situation with non-embedded deductibles, in which just the family cap basically or deductible applies to the entire group, no matter who spends the money. But that brings us to the idea of coinsurance. So coinsurance is basically the phase that you're going to run into after you get through the deductible phase. So if I'm looking at coinsurance, basically what that's going to specify is once I get past the deductible, whether it's embedded or non-embedded, whatever. Once I've gotten past the deductible limit, then we're in the coinsurance phase. And what that means is your plan is going to specify that something like this. Basically, if we're in the coinsurance phase, the insurance company will pay perhaps 80% of the covered costs, and you, the individual, will pay 20. So let's say that it's just you on your health policy with a deductible of $1,000, okay, and you have $2,000 of medical expenses. And to keep things simple, we won't have a family involved here. But let's say it's just you on your own policy with a $1,000 deductible, and you have $2,000 of medical expenses in the year. And your coinsurance is 80/20. So what's going to happen is you're going to pay the first $1,000 because that's part of your deductible. Once you've capped out that deductible, you hit the $1,000. The second $1,000 in our $2,000 of medical expenses example is basically going to be a situation in which the insurance company is going to pay 80% of that, so $800, and you are going to pay $200. And so what's going to happen there is you still have to pay some, they pay some as well. And basically that is designed to ensure that you are always paying something. And the idea there is to ensure that you always have some kind of monetary incentive, basically to not buy healthcare that you don't really need. And that's kind of the idea behind that. You have skin in the game, you have a financial incentive to not engage in medical procedures or appointments that aren't really necessary. Now, also, there are going to be out-of-pocket caps. So out-of-pocket caps basically are going to limit the total amount of healthcare spending through the year, okay? And those can be done either in an embedded or non-embedded way. So this is the same thing as like with the deductible. So if it is embedded, what that means is that there is an out-of-pocket cap per individual and a cap per family, if you have a family plan. So what that would mean is, let's say my out-of-pocket cap is $5,000 per individual and $10,000 per family. What that would mean is, if I have a $1,000 deductible, I pay the first $1,000. Then I'm doing co-insurance after that, where the insurance company is going to pay, say, 80%, and I pay 20%. If I have a crazy expensive scenario, so that by the time I pay my $1,000 and I have my 20% of all expenses after that, and if the total amount I've spent hits, say, an out-of-pocket cap of, say, $2,000, then in that case, basically what that means is once I've hit that embedded maximum out-of-pocket cap for me as the individual, and whatever spending occurs for me as the individual is going to be paid for completely by the insurance company at that point. And basically with that embedded maximum out of pocket, there will be a maximum out of pocket per individual and a maximum out of pocket for the family as a whole. And so basically you look at the full situation there of, have I hit the embedded maximum out of pocket for the individual? But I also have to look at, have I hit the maximum out of pocket for the family? And once you start getting past those maximum out of pocket levels, whether at the individual level or the family level, and basically what that means is then the insurance company is going to be paying all of it. Non-embedded maximum out of pocket would be a situation in which I don't have that individual maximum cap. I just have a family level maximum out of pocket cap. And so in that case, maybe I have a $10,000 maximum out of pocket for the entire family. And so you don't hit a maximum by accruing, say, $1,000 or $2,000 or whatever the number is for the individual. It just matters the family. So ultimately, for deductibles and out-of-pocket caps, if there are embedded in deductibles or embedded maximum out-of-pocket, both of those will result in the insurance company picking up the costs sooner and basically getting involved sooner if you have a family situation. So those are going to result in potentially lower costs if you have significant events that go on. Now, and significantly, there's a limit on how high those out-of-pocket caps can be due to the Affordable Care Act, at least under current legislation. So there's a limit to just how high those out-of-pocket caps can be before the insurance company has to kick in and basically just start covering all those costs. Hopefully this video has been helpful. Have a great day, and thanks for watching.